Essentially, everyone at one point or another had an enlarged lymph node somewhere. And most of the time, they are just reactive to something and they are not very serious. But if they don't go away in a few weeks or a few months, it could mean that you have something more serious. And then the only way to really know what's happening is to do what's called a lymph node biopsy. And it's actually a very simple procedure that we do in the office. And I'm going to explain everything that you need to know. I'm going to explain what's a lymph node, when a biopsy is necessary, how the procedure is done, and what to expect after the procedure and how to recover from it. So lymph nodes are these small glands that are part of your immune system. And they can be located everywhere, usually around blood vessels. They can be in the neck, in the axilla, inside the chest or abdomen, or in the groin. And they are essentially connected to the lymphatic system. They are super helpful in fighting harmful things like bacteria, viruses, or even cancers. And of course, an infection like a virus or a bacteria is the most common cause of a lymph node enlargement. But they can also get big due to other conditions like inflammatory diseases such as lupus, or an autoimmune condition where your immune system is attacking your own body, or even sometimes in more serious conditions like lymphoma, which is a cancer that starts on the lymph nodes, or some other type of cancer like a lung cancer or a breast cancer, or a head and neck cancer that started somewhere and then got stopped in the lymph nodes. And I know all these conditions and these names sound very scary, but the bottom line is we see patients all the time with mild enlarged lymph nodes in the neck or in the groin and even axilla. And most of the time, I would say more than 99% of the time, these are just what's called a reactive lymph node. A reactive lymph node is an inflammation of the lymph node that is usually caused by a systemic infection like a virus, or an inflammatory process throughout your body, or some infection that happened in your hand or in your mouth, maybe a tooth infection that migrated to the lymph node. And most of the time, they will resolve on their own. And I would say if you had a respiratory infection of some sort, or a tooth problem, or you had some infection in the hands or in the feet, it's very common to have an enlargement. But when do we start worrying about lymph nodes? Some of the warning signs are if the lymph node is growing over time, it has been present more than a few weeks or more than a couple of months and it's not getting smaller, or if the lymph node is bigger than 2 centimeters or bigger than an inch. Those are situations that we start worrying more. It doesn't mean that they will be cancer, but it means we may need to find out what they are, or at least get some imaging to see more exactly what we're dealing with. Also, patients that have been losing weight or have other symptoms that are worrisome, they need to be investigated sooner. There are also serious infections that can go to lymph nodes, like tuberculosis can present itself as an enlarged lymph node, and cat scratch disease or some more serious fungal infections can also present with an enlarged lymph node, and they may need a biopsy to actually diagnose these conditions. I think if you had an infection like a viral infection and you had some enlarged lymph nodes, I think you can watch them for a few weeks. But if the lymph node's not getting smaller or is even getting larger, or if it's a very big lymph node, you should get checked by a doctor. If you've seen a doctor and the doctor checked your lymph nodes and he thinks they are somewhat worrisome, you may need a biopsy, because the biopsy is the way that we find out for sure that these lymph nodes are cancer or not. And in the case of infections, they can determine also what type of infection they are, especially if they are a serious infection like tuberculosis or some type of fungal infection. And there are several types of biopsies. So there is, for example, a fine needle aspiration. A fine needle aspiration is when we use a very thin needle to aspirate and collect cells from the lymph node. It is less invasive and less risky because it's a very small needle. If you know the sizes of needles at 25 gauge that we generally use. But most of the time, it does not provide enough information for certain diagnoses. So although it's a little bit less risky, fine needle aspiration is not always sufficient. Most of the time, what we end up doing is what's called a core biopsy. It's a slightly bigger needle. It's not that big. It's done with local anesthetic. And what we do is we insert this special needle that takes a little bite of the lymph node. So it gets a little piece of tissue that it's very small, but it can be analyzed in a microscope. And they can see actually the architecture of the lymph node and determine if they're a lymphoma or they're a cancer, or if they are just essentially a reactive lymph node. A fine needle aspiration will be very hard to determine if a lymph node is just reactive. Whether a core biopsy, it's usually very accurate. I would say 99% of the time, a core needle biopsy is all we need to diagnose any condition in a lymph node. But really small chance that some conditions may require what's called an excisional biopsy. An excisional biopsy is when you make a cut over the lymph node and then you dissect and remove the entire lymph node. This is a surgical procedure. And like I said, the entire lymph node is removed. This is only done nowadays. It's very rare. It's only done when we did a core biopsy and it was not enough to make a diagnosis. And I've only seen that happening in some types of lymphoma. Also, although these needle biopsies used to be done blindly, nowadays they're usually done by an interventional radiologist, which will use imaging guidance to do that biopsy. That will not only assure that we are biopsying a lymph node and exactly the lymph node that is suspicious, but also will make sure that we don't damage any nearby organs. And what do we do with the tissue sample? We usually just collect the tissue and we'll put in a couple of different mediums. And we usually just connect the tissue, which are little bites of the lymph node. They're little cylinders that we put in at least 2 or 3 different solutions, and we send this to a pathology laboratory for analysis. Pathologists will then examine this sample under a microscope to look for cancer, infection, or any abnormal cells. Depending on the findings, we will also send samples to specialized tests that can be performed. For example, one of them is called flow cytometry, which they run all these lymphocytes through a machine, and the machine can determine if they're all the same lymphocytes or they are all different lymphocytes. Because in a normal lymph node or a reactive lymph node, you have multiple different lymphocytes. You have lymphocytes to fight all sorts of different infections. When you have a cancer like lymphoma, they are all a clone of lymphocytes. They are all the same, like an army. And this test, the flow cytometry, is what's very helpful in determining if you have something serious or is it just a reactive lymph. We also sometimes send the samples for microbiology cultures, especially if needed, if we're suspicious that could be tuberculosis. Those cultures can take a long time, can take 4 to 6 weeks to grow. We also can send for different types of bacteria and fungal tests, depending on what the suspicions are. And if you have a cancer or the biopsy was consistent with a cancer, nowadays we can send the samples for a variety of tests that include molecular testing to determine what's the best chemotherapy, how to best treat them, or even genetic studies. And what are the risks of a needle biopsy? Needle biopsies are very safe and we do them all the time, but there is a risk of bleeding, particularly if a lymph node is close to a blood vessel, of course. There's a risk of an infection at the biopsy site, although that's really, really rare. I don't think I remember one. Sometimes patients can have pain at the site for a few days, and bruising is common at the site where you're going. So especially if you have a lymph node in the neck, it's better to explain to your spouse that you're getting a lymph node biopsy, otherwise you may show with a hickey and may be more difficult to explain. And finally, very rarely you could have injury to the surrounding structures, especially if the lymph node is located deeper in the body or near a nerve or near a blood vessel. Of course, we use every precaution possible to minimize these risks. We do a lot of these procedures, understand the anatomy very well. We also use state-of-the-art imaging guidance and sterile techniques for that. What do you need to watch after the procedure? Well, it's normal to have mild soreness, bruising, and swelling at the biopsy site, but these symptoms should not be getting worse. But of course, you should call us right away if you develop severe pain or pain that is increasing over time. The pain should not be getting worse. Also, mild swelling at the site is normal because we inject a lot of anesthetic, but it should not be growing and it should not be big or tense. So if any of this happens, you need to let us know. Also, it's uncommon, but you could have a little bit of bleeding at the site. If you do, what I would do is just put your finger in it for like 10 minutes and it should stop. Obviously, if it doesn't stop, you also need to let us know or even go to an emergency room. Like I said, infections are really, really rare and they don't happen right away. They will happen a few days later. And what would happen is that the site would get more and more red. So it could be a little red the day after, but it shouldn't be getting worse. But if the redness is getting worse or you start having some drainage of pus or something, it could be an infection and you need to let us know and we may need to start you on antibiotics. Of course, if you start developing a high fever after the procedure, it's important to let us know. Of course, you could have a fever from the underlying condition, the same condition that is causing the enlargement of the lymph nodes. But if that's a new thing, you should let us know. How long do you need to recover after the procedure? So most patients recover very quickly. You usually go home a few minutes after the procedure. We usually recommend avoiding heavy weightlifting or very heavy exercise in the first day after the procedure, but then the day after, you should be fine to go back to your routine. Most of the time after the biopsy, we put a drop of surgical glue at the site to avoid leakage or bleeding, and we'll seal the area so you can take a shower the same day of the procedure. And by next day, the site should be completely healed, so you can even peel off the glue if you want. How long does it take to get your results back? Most pathology results are available within 3 to 5 business days. But sometimes if specialized tests are needed, such as cultures or genetic studies, that could take a longer time, could take up to a month. Once the results are back, my team or your doctor will let you know and discuss the results and what are the next steps. I hope this video helped you understand a little bit more about lymph node biopsies. I hope this reassured you that this is a very simple procedure and very effective in diagnosing conditions. So our goal is to make this procedure as safe, as comfortable as possible while getting the answers that we need, right? If you have any questions, obviously don't hesitate to reach out to our office.